The Doctor's Journal, brought to you by Medical Associates Hospital, Jameson and O Snacks.
In the blink of an eye, a silent intruder strikes, tearing apart the beats of life.
Today we unravel the mystery and the peril of a heart attack, a force that challenges even the strongest of souls.
Welcome to the Doctor's Journal. Today we focus on a life-threatening cardiovascular event that affects millions worldwide, heart attacks.
Let's start by defining a heart attack. What exactly is a heart attack and what happens during this cardiovascular event?
Well, Dr. Sunarayan, a heart attack, also known as a myocardial infarction, occurs when blood flow to a section of the heart muscle is significantly reduced or completely blocked.
This blockage is often caused by a blood clot that forms in a coronary artery, which supplies the oxygen-rich blood to the heart. As a result, the affected part of the heart muscle is deprived of oxygen, leading to damage and, if not treated promptly, potential death of the heart tissue.
Now, the most common symptoms of a heart attack include, obviously, chest pain or discomfort, which may feel like a pressure, squeezing, or a heaviness, as if someone is standing on your chest. The pain may radiate down the left arm, up the neck, and to the jaw.
That's right, Dr. Mike. So additionally, individuals may experience shortness of breath, nausea, lightheadedness. We'd also see them who experiences cold sweats. However, it's important to note that not all heart attacks present with the same symptoms. Some individuals may experience atypical or silent heart attacks, so that it means it presents with all the obvious symptoms.
Exactly. But who is at risk of experiencing a heart attack? We'll tell you more after a short break.
Welcome back. In this episode, we are discussing heart attacks. But what are some of the risk factors? Several risk factors can increase the likelihood of experiencing a heart attack.
These include advancing age, particularly over 45 for men and over 55 for women.
Family history of heart disease, smoking,
High blood pressure, high cholesterol levels,
obesity, physical inactivity, as well as
diabetes.
Yes, Dr. Mike. So lifestyle factors such as a poor diet and chronic stress can also contribute to risk. Diagnosing a heart attack involves a combination of clinical evaluation, medical history review, and diagnostic tests. Electrocardiograms or ECGs or what we call EKGs sometimes are commonly used to assess the heart electrical activity and identify specific patterns that are indicative of a heart attack.
That's right, Dr. Sunarayan. Blood tests such as cardiac enzymes and troponin levels help confirm the presence of heart muscle damage. Imaging tests like echocardiograms can show us the pumping action or strength of the heart muscle, referred to as the ejection fraction as a percentage, example 50%. So for all our listeners out there who have had an echo, please be sure to either remember your EF percent or walk with your echo report to your doctor visits. It can prevent unnecessary repeating of tests.
Coronary angiograms can provide detailed information about the heart structure and blood flow to decide the need for intervention. More on this later.
What about the potential complications associated with a heart attack?
Well, heart attacks can lead to various complications, including heart failure, where the pumping action may be reduced, arrhythmias, which are abnormal heart rhythms, cardiogenic shock, which is a severe drop in blood pressure, and also damage to the heart valves.
The risk of future heart attacks and other cardiovascular events is also increased in individuals who have already experienced a heart attack.
However, timely and appropriate medical care significantly reduces the risk of complications and improves the outcomes.
Dr. Sunarayan, let's explore the immediate treatment for a heart attack. This treatment aims to restore blood flow to the affected part of the heart as quickly as possible.
Yes, Mike, and this is typically done through medications to dissolve the blood clot called thrombolytics, or a minimally invasive procedure called percutaneous coronary intervention, otherwise known as PCI or angioplasty.
During PCI, which is the gold standard of treatment, a catheter is threaded through a blood vessel to the blood coronary artery, and a stent similar to a little cage is deployed to open the artery and restore blood flow.
Well, when we come back, we'll dive deep into the intimate details of angioplasty with a cardiologist and his patient.
Hi, I'm Onella Selena, a registered dietitian and a nutritionist for Jameson. Chronic diseases such as heart disease and type 2 diabetes are the leading cause of death and disability in Trinidad and Tobago, as well as the Caribbean region. Hence, it is important to support good health and reduce the risk by incorporating antioxidants into our daily routine. Antioxidants like vitamin C and vitamin E are nutrients that can help protect our cells from damage caused by free radicals. So you want to ensure that you get the recommended daily intake by eating your fruits and vegetables and additional support from your supplements. So remember, when in doubt, ask the expert at Jameson. Together, we can make informed choices and live a healthier lifestyle.
Is it difficult for you to go to the doctor? Then call us today and get a doctor at your doorstep. Our qualified team of doctors are ready to help, and we specialize in convenient at-home care, including blood tests, pap smears, diabetes management, vaccination, and so much more. Get the care you need and get a doctor at your doorstep. Call 480-4DOC to set up an appointment or to get more information.
Today we are at Medical Associates Cardiac Catheterization Laboratory. We have a patient here with us with a history of diabetes and high blood pressure who is coming in with complaints of chest discomfort. We're going to do a diagnostic procedure to take a look at the heart arteries and evaluate for any potential blockages. If we find a potential blockage that we can fix with an angioplasty and a stent procedure, we're going to go ahead and fix it at the same time. So at the start of the procedure, the first thing that we do is that we get access to the arterial system, and we do this most of the time through the radial artery in the wrist. We've already obtained our arterial access. So our next step is to begin advancing wires and catheters up through the arterial system to get to the heart. So what you're seeing on the screen is a very small wire being advanced up through the arterial system of the wrist and into the arm. This wire is then advanced further up through the arterial system all the way up into the main blood vessel called the aorta. Over this wire, a small plastic tube called a catheter is then advanced into the aortic root, which is where the heart arteries originate. Once our catheter is appropriately positioned in the artery, we inject X-ray dye, which then opacifies the blood vessels, and we record images. And we are injecting contrast into the heart arteries and recording images on the screen. Okay, what I'm seeing here is that we do indeed have an 80% blockage in the circumflex artery. We're going to have to proceed to do an angioplasty and a stent procedure. Let's prep for angioplasty, please. So in order to do an angioplasty and a stent procedure, we have to switch up our equipment and change to a different catheter, which will allow us to actually fix the blockage as opposed to just taking pictures. So we are preparing to do our angioplasty and stent procedure. And this is our angioplasty wire. This is the wire that's going to be advanced down into the heart artery. It's a very small wire. And this wire is gently introduced all the way down into the heart artery. And then very gently maneuvered down the blood vessel, past the blocked area, and then positioned in the artery beyond the blockage. Once the wire is appropriately positioned, we then advance our stent, which is our metal scaffold, and our stent goes in over the wire that we had previously advanced into the blood vessel. And we then position our stent right where the artery is blocked. We have positioned the stent, and now we are going to inflate using our inflation device and deploy the stent. And the stent is deployed. And now the stent is in place. And having deployed the stent, we take a picture after the stent has been deployed, and we can see that where the 80% blockage previously was has now been reduced to 0% blockage. The blockage has been completely cleared. And at the very conclusion of the procedure, we remove our wire and take one final picture, and we can see that the artery has been completely fixed of blockage with a very nice result. At Medical Associates Hospital, our response to a heart attack is characterized by speed and efficacy. Our accident and emergency team is well trained and ready to respond swiftly to any cardiac emergency. And we have quick access to an interventional cardiologist 24 hours a day, 7 days a week. Upon arrival, our team springs into action, ensuring rapid assessment and diagnosis. With state-of-the-art equipment and dedication to cutting-edge treatments, we prioritize minimizing the time between arrival to the hospital and access to life-saving treatment. The treatment we offer here at Medical Associates Hospital is equivalent to what you would find in more economically developed countries, and in some cases, in shorter timeframes. Our collaborative and multidisciplinary approach guarantees that patients receive immediate, life-saving interventions and personalized care, ultimately leading to improved outcomes and a faster road to recovery. Your heart health is our top priority, and we are here to provide you with the most efficient and effective emergency care possible.
At Athena Clinic, we're committed to helping you boost your confidence and live your best life. Enhance your appearance with a non-surgical procedure, or optimize your health with one of our expert doctor consultations and diet and fitness plan. Call today at 282-2262. So what should we know about heart attacks? Well, today we have Dr. Ronan Ali, interventional cardiologist, to discuss heart attacks. Welcome to the show, Dr. Ali.
Thank you for having me.
So, to start off, How extensive, in your opinion, is the burden of coronary artery disease and heart attack in our country?
What I can tell you from my experience in the public and private sectors, within Trinidad and Tobago, I think we have at least 10 heart attacks daily.
Wow.
That's a lot, yes.
Yeah, that's a lot.
And it doesn't even take into consideration those patients who have what we call stable coronary artery disease. Chest pains when they exert themselves without actually having a heart attack. So the prevalence of coronary artery disease is very high.
So what does PCI or angioplasty entail, and can you walk us through that procedure?
So a PCI or angioplasty procedure is the procedure where we correct a blockage within one of the heart arteries. We start off such a procedure by getting access to the arterial system. And we can get that access either through the radial artery in the wrist or the femoral artery in the leg. I do almost all of my procedures from the radial artery in the wrist. It has been shown that patients tend to prefer that access site. It's more comfortable for them, and the complication rates are a little bit lower compared to the femoral access. This will show us exactly where those blockages are, and therefore what needs to be done to fix them.
So, what criteria or conditions need to be met for a patient to be considered for primary PCI?
Well, primary PCI refers to the procedure where a patient having chest pains or heaviness or tightness or possible heart attack symptoms comes into the emergency room and we note a particular pattern on the ECG. And that particular pattern is a signal to us that one of the heart arteries is probably completely blocked. When a heart artery is completely blocked, it's a medical emergency. Part of the heart muscle begins to die. So as soon as we can get that artery open and restore the blood flow, we have less heart muscle damage. So that's a primary PCI procedure. Most patients would be candidates for a primary PCI procedure once they have that particular pattern on the ECG. Of course, they have to consent to the procedure, and they have to be willing to be very faithful with their medications after we do the procedure. Because when we insert that metal scaffold or that stent, we need patients to be on blood thinners or antiplatelets, as we call them, in order to prevent blood clots from forming on that stent. So they have to be very faithful with their medications after the procedure. And of course, we would want to know if they had any sort of bleeding issues or potential bleeding problems, because going forward, they would be on those blood thinners. So we would want to make sure that they would be able to tolerate those medications before we do the procedure.
Okay. Do you think patients here with heart attacks get to the hospital on time?
Well, we see a wide range. We see some patients who come to the hospital almost right away, and we see some patients who wait 24, 36 hours before they come to the hospital. But as we alluded to earlier, the sooner that we get that heart artery unblocked and we restore the blood flow, is the better the outcome. So we really want patients to come to the hospital as soon as they have any symptoms suggestive of a possible heart attack. Most of them don't.
What are your recommendations in regards to returning to work, driving, exercise, etc.?
Generally speaking, we would recommend a 6-week waiting period. And during that time, the heart is healing after the heart attack. We don't want patients doing any sort of strenuous activity. We similarly recommend against driving or going back out to work for that 6-week period. There are some instances where we may shorten that a little bit. If a patient, for example, comes in very early and we're able to restore blood flow quickly and there is little to no heart muscle damage, then in conjunction with your cardiologist, you may come to an agreement to shorten that time window a little bit. But generally speaking, it's a 6-week recommendation for return to work, driving, strenuous activity. So generally speaking, after a heart attack, you'd be in the hospital for about 3 to 5 days. Once they're discharged, then the number one thing really is the medications. The medications are critical, and yes, patients are not always the best at sticking with their medications, but we try to explain to them the importance of the medications, and hopefully that message gets through. and they can follow up and do the necessary. It's also a lifestyle change. After a heart attack, we want to encourage patients to change their diet, adopt a more healthy eating habit, adopt healthy attitudes towards exercise and weight control and cigarette smoking if necessary. So it really is a lifestyle change as well. If you are having symptoms that could be attributable to a heart attack, especially if you have risk factors, then you need to get to an emergency room quickly, get evaluated, get an ECG done, and it may be that the doctor can then reassure you and say, no, this is not anything to do with your heart, but in the event that it is a heart attack, we can then initiate appropriate treatment early, which is the key for treating a heart attack.
Safe rather than sorry.
Exactly.
Right, so thank you, Dr. Ali, for sharing your expertise and shedding light on the importance of prevention. Your insights serve as a reminder that taking care of our hearts, health is our responsibility, and we all share that.
So comment right up. We help you get your health back on track with a much needed diet shift.
Hi everyone, I'm Nandini Samuel, a registered dietitian, and today we are going to speak on the importance of reading nutrition facts labels for heart disease patients. Oftentimes I ask my patients if they read nutrition facts labels when they visit the grocery store. Most times the answer is no, or maybe I don't know how to read it. That is why today I will be educating you on reading nutrition labels. The nutrition facts section of your label will tell you the calories, carbohydrate content, added sugar, fat, protein, vitamins and minerals per serving of food. This would make it easier when comparing to other food items that are similar. Reading food labels can actually help you to make a healthier, more informed choice. So here today I have the sample label for macaroni and cheese. So the first thing you're going to see is the serving size, then the servings per container, all of the nutrients, and what we call the daily percentage value. So of course the serving size is 1 cup and the servings per container is 2, which means there are 2 amounts or 2 cups of macaroni and cheese in this package. However, the calories is only going to tell you for 1 cup. So when reading nutrition labels, it's important to also look at the daily percentage value. 5% or less is considered as low, and 20% or more is considered as high. So in terms of saturated fats, here on the screen you can see 15% in 1 serving. So therefore, in 2 servings, it would be 30%, which is considered as high. In terms of sodium, 20% in 1 serving, so therefore 2 servings would be 40%, also very high. So in terms of ingredients, we want to read ingredients in a descending order. Therefore, for example, water, sugar, citric acid, natural flavors are some of the ingredients in this package. However, the first ingredient would always be what is most of in this product. When sugar is in the first 3 ingredients, that is something we want to try to avoid. So today, I will be preparing a healthy yogurt bowl recipe with you. So we have our Greek yogurt, our unsweetened granola, almonds, chia seeds, cashew nuts, our kiwi, or you can use any fruit of your choice, and we have Brazil nuts and cinnamon. So first we are going to add our plain Greek yogurt to our bowl. Ensure guys that it's plain Greek yogurt with no added sugar. Greek yogurt is shown to be very high in protein. So we add our yogurt. Then we want to sprinkle our cinnamon onto our yogurt. Add our unsweetened granola. So again, it's important to read your nutrition labels to ensure that there's no added sugar. Add a few almonds that is rich in vitamins and minerals and good fats. Some chia seeds. Some cashew nuts. And now we want to add at least 2 or 3 Brazilian nuts. Brazilian nuts is very high in selenium, which is good for inflammation, thyroid health, and even heart disease and heart attacks. Then we have our kiwi. Of course, your fruit choice is optional. Pawpaw, watermelon, and pineapple are shown to be the very high glycemic index fruits. So of course, we want to remember to monitor how much we would be using throughout. And there we have it, guys, a healthy yogurt bowl that you can enjoy for breakfast or even at snack time.
This segment was brought to you by O Snacks.
Recognizing and promptly responding to symptoms of a heart attack can be life-saving.
Remember, as we always say, time is muscle, heart muscle to be precise. If you or someone you know experiences chest pain or other symptoms suggestive of a heart attack, seek emergency medical attention immediately. Acting quickly can significantly improve the chances of a positive outcome. You have been watching the Doctor's Journal. I'm Dr. Mike.
And I'm Dr. Sunarayan. Take care of you for us.
The Doctor's Journal was brought to you by Medical Associates Hospital, Jameson and O Snacks.